I'm Ruth Anderson, 77 years old. After my husband died, my son Derek convinced me to apply for Medicaid and move into a care facility so he could manage my assets. I discovered he was billing Medicaid $12,000 monthly for fake medical services while keeping me isolated and stealing my Social Security. Derek thought an elderly widow in a nursing home couldn't fight back. He forgot I worked as a healthcare fraud investigator for Medicare for 30 years. This is how I exposed his scheme and sent him to federal prison. Don't forget to subscribe. Hit that bell icon so you never miss revenge stories like this. Posted to r/pro revenge by you/justice for grandma. My name is Ruth Anderson, 77 years old. My husband Carl died 8 months ago after 54 years of marriage. We had one son, Derek, age 52. Derek had always been financially irresponsible, multiple failed businesses, 2 divorces, constant debt. But after Carl died, Derek suddenly became the concerned son. Mom, you can't live alone anymore. What if you fall? What if something happens? Let me help you apply for Medicaid benefits. There are excellent care facilities where you'll be safe. I didn't need a nursing home. I was healthy, active, mentally sharp. But Derek was persistent. He painted terrifying pictures of elderly people dying alone, falling and unable to call for help, developing dementia without anyone noticing. In my grief and vulnerability, I let him convince me. Derek helped me apply for Medicaid, transferred my house to a trust he controlled, and moved me into Riverside Care Facility. Just temporary, Mom. Until you're feeling stronger. For the first month, Derek visited regularly. He brought flowers, magazines, told me how much he loved me. Then the visits stopped. I tried calling Derek. No answer. I left messages. Nothing. I asked the facility staff to contact him. They said Derek had put restrictions on my communication, claiming I had confusion issues and shouldn't be calling people unsupervised. I was trapped. One afternoon, I overheard 2 nurses talking outside my room. Ruth Anderson's son is billing for daily physical therapy visits. She hasn't had PT in 3 weeks. He bills for speech therapy, too. I've never seen a speech therapist in her room. My heart started racing. I knew exactly what this meant. Before I retired, I worked as a healthcare fraud investigator for Medicare for 30 years. I'd investigated hundreds of cases of providers billing for services never rendered. Derek was committing Medicaid fraud using me as the patient. I started paying attention to everything. I documented every service I actually received versus what Derek claimed to Medicaid. The facility was complicit. They were getting kickbacks from Derek for allowing the fraudulent billing. Derek was billing Medicaid for daily physical therapy, $180 per session. I received PT twice in 4 months. Speech therapy 3 times weekly, $150 per session. Never received once occupational therapy, $120 per session. Never received medical equipment rentals, $400 per month. Equipment never provided specialized nursing care, $200 per day. No specialized care given. The total? Derek was fraudulently billing Medicaid approximately $12,000 per month. Over 4 months, that was $48,000 in fraudulent claims. And my Social Security checks? All $1,847 monthly, going directly to Derek's bank account. He was supposed to use that money for my care expenses. Instead, he was pocketing it while Medicaid paid for everything, including services I never received. I couldn't make phone calls freely or leave the facility, but I'm a fraud investigator. I know how to gather evidence. I befriended the night janitor, Marcus, who'd worked there for 20 years. Marcus hated the administrator and the corruption he'd witnessed. Mrs. Anderson, this place has been running scams for years. Your son isn't the only family member doing this. Marcus, I need to contact the Medicare fraud hotline. Can you help me? Marcus let me use his cell phone during his shift. I called the Office of Inspector General Fraud hotline and reported everything. This is Ruth Anderson. I'm a former Medicare fraud investigator. I'm currently being used as a victim in a Medicaid fraud scheme perpetrated by my son, Derek Anderson. I have documentation of $48,000 in fraudulent billings over 4 months. I'm being held in a facility that's complicit in the fraud. I need immediate investigation. The fraud investigator on the phone recognized my name. Ruth Anderson, you worked the Tampa office in the 90s, right? You trained me in 2003. James Chen, is that you? Yes, ma'am. Ruth, we're opening an investigation immediately. Stay safe. We'll have agents there within 72 hours. 3 days later, federal agents from the Office of Inspector General raided Riverside Care Facility at 6 a.m. They seized computers, billing records, financial documents, and interviewed every staff member. They also arrested Derek at his home. When agents searched his house, they found evidence of multiple Medicaid fraud schemes involving at least 8 other elderly patients at various facilities. Derek had been running this scam for 3 years, stealing an estimated $380,000 from Medicaid using fake billings for elderly patients, including his own mother. Agents also discovered Derek had drained my entire savings account, $127,000 I'd saved over 40 years. He'd transferred my house to himself and was planning to sell it. He'd stolen my Social Security checks for 4 months, totaling $7,388. Derek had stolen everything while leaving me imprisoned in a nursing home where I didn't need to be, all while fraudulently billing the government for fake medical services. Derek's trial took place 6 months later. Federal prosecutors charged him with healthcare fraud, wire fraud, theft of government funds, elder financial abuse, and conspiracy. The evidence was overwhelming. Prosecutors presented billing records showing hundreds of fake claims. They showed Derek's bank statements proving he'd deposited the fraudulent Medicaid payments. They showed he'd stolen my Social Security and savings. The prosecutor asked me to testify. "Mrs. Anderson, tell the court about your experience." I testified with the precision and clarity of someone who'd spent 30 years investigating these exact crimes. My son Derek deliberately had me placed in a nursing home I didn't need. He then used my patient status to bill Medicaid for thousands of dollars in fake medical services. He stole my Social Security income. He drained my savings. He isolated me so I couldn't report what he was doing. Derek committed healthcare fraud using his own mother as the victim. This is textbook Medicaid fraud. I know because I investigated these cases for 3 decades. Derek's lawyer tried to claim he'd been confused about billing procedures. I destroyed that defense on cross-examination. Your Honor, healthcare billing is heavily regulated. My son knew exactly what he was doing. The billings were too detailed, too consistent, and too profitable to be mistakes. This was deliberate, systematic fraud. The jury convicted Derek on all charges. The judge sentenced him to 12 years in federal prison and ordered him to pay $380,000 in restitution plus penalties. Mr. Anderson, you defrauded the government of hundreds of thousands of dollars. You stole from your own elderly mother. You imprisoned her in a facility she didn't need. You are a predator who exploited the healthcare system and your own family. 12 years in federal prison. The facility administrator was also convicted of conspiracy and accepting kickbacks. Riverside Care Facility was permanently shut down by the state. I recovered my house, my savings, and my freedom. The federal government recovered most of the fraudulently paid money. I received full restitution plus damages. I'm now 77 years old, living independently in the home Carl and I built together. I volunteer with the Office of Inspector General as a consultant, helping train new investigators in healthcare fraud detection. Medicaid fraud targeting elderly patients is one of the fastest-growing white-collar crimes, I tell training sessions. Family members see vulnerable parents as profit sources. They place them in facilities unnecessarily, bill for fake services, and steal their income. But some of us elderly people spent careers fighting fraud. Derek learned that the hard way. Derek is now 4 years into his 12-year sentence. He'll be 64 when released, old enough to understand what it feels like to have your freedom taken away. People ask if I feel guilty about sending my son to prison. The answer is no. Derek stole from taxpayers, stole from me, and imprisoned me for profit. He deserves every day of that sentence. I'm a retired healthcare fraud investigator. I spent 30 years catching criminals who stole from Medicare and Medicaid. When my own son tried the same scheme using me as his victim, I used those same skills to destroy him. Derek thought an elderly woman in a nursing home was helpless. He forgot his mother was the investigator who wrote the training manual on detecting exactly what he was doing.